Hey everybody, it's Dr. McWilliams from McWilliams Vein Center. I've been treating veins now for about 20 years. I've trained multiple physicians on how to treat veins correctly, trained multiple ultrasound techs, but it never ceases to amaze me when I hear some of the things that are going on out in the field. There's a lot of people treating veins that probably should not be. So when you go to get your veins treated, even if you're just going for spider veins, you can't tell where the problem starts unless you look with ultrasound. If someone comes into my office and all they have is spider veins and no complaints, we're going to do just a quick unofficial ultrasound to see if there's anything larger underneath, just so we know what we're dealing with and we can give the patient realistic expectations on how successful we're going to be. That's at no charge because we're not going to bill the insurance for an ultrasound if there's no symptoms. But if you have symptoms, if you have large bulging veins, you need to have an ultrasound done, a thorough ultrasound exam of the superficial system. I had a patient today who was in, she had been somewhere else. She told me they did the ultrasound, but she was lying down the whole time. Ultrasound of the superficial system should not be done with the patient lying on the bed. You need to be standing up in a vertical position. It should be on a legitimate ultrasound platform. It shouldn't be just a aerobic step or a small little table. The reason being, when you're assessing the superficial system, you need gravity to show you whether the blood is flowing one direction, forward past the ultrasound probe, which is what it should be doing, or if it flows forward and then falls back down. The only way you can determine that is if you've got gravity helping you out, which means you're standing. Now, this is different than a deep scan. When you're looking for a blood clot in the deep veins, you do have the patient lying down, and part of the superficial scan is assessing the deep veins, so you may be lying down for part of it, but to really evaluate the superficial veins, you have to be standing up. So if you go someplace and they don't check you at all with ultrasound, that's a red flag. If they send you out to have the ultrasound done someplace else, that's a red flag. Hospitals are not going to do a good job at assessing the superficial venous system. If they have you lying down for the entire ultrasound, that's a big red flag. You're not going to get the type of care you need. You need to go to someplace that specializes in vein disease. So give us a call at McWilliams Vein Center. You'll get expert care by the experts in vein care, and you'll be treated like family.